Hello, YouTube. I'm Silk Chon. I'm a student nurse. So thank you so much and enjoy the video. So let's jump into today's topic, the breast cancer. According to Cancer Australia, 20,336 new cases of breast cancer in 2025 and 83,800 people diagnosed with breast cancer since 2021. The number is huge, but don't worry, there are intervention and preventative cares. So understanding breast cancer is important for health consumer to improve preventative cares and recognize early symptoms to access interventions promptly. This presentation aims to educate about the definition, the etiology, the root causes, the symptoms, the risk factors, the diagnosis, the treatments, options, and preventative educations for breast cancer chronic condition. So what is breast cancer? Cancer Australia define breast cancer as uncontrollable growth of abnormal tumor cells inside the breast, developing at any ages, most likely older. So it's when the malignant tumor cell grow and it's uncontrollable. So what are breast cancer's symptoms? Breast cancer can be detecting with a lump, sometimes painless lump. People may spot changes in breast size and shape when self-examined during shower. How to spot changes in nipple? So observe the inversion nipple turning upwards, changes in color and texture of the nipple discharge that are not breast milk, and there's changes in breast skin as well. When the skins appear dumpling, puckering, redness, scaling, swelling, and sometimes with orange peel texture. There is swollen under the armpits or near the collarbone and having breast pain. The symptoms and clinical manifestations can involve with cell dryness that develop into breast ulceration, and breast pain arises from the obstructions of the cell inside the breast. Vasodilation causes swelling due to obstruction of the dilated superficial veins. Bleeding may occur when erosions to the blood vessels. Inflammation causes redness, tenderness, and warmth to the breast. Edema is excessive fluid buildup in the lymphatic system when there is inflammation or lymphatic obstruction. These causes swelling under the armpit area. Some patients experience chest pain episode because the malignant cell spreads to the lung. The orange peeling texture of the breast is similar to the pitting of the skin. Dimpling breast appearance occur when retractions of Cooper's ligament and the pectoralis fascia metastasizes to dermal lymphatic. Sensory ligament causes skin retraction, and less mammary duct result in nipple retraction. The nipple is discharged and non-lactating women due to tumor obstruction for them, and nipple or areolar eczema can develop into Paget's disease. So what is the root causes of breast cancer, like the etiology? The causes of breast cancer linked to alteration of p53 protein causes genetic mutation. Here I want to open bracket and inform why p53 protein is so important for gene production. So there are 6 functions of p53 proteins. One is it arrests the tumor cell growth. Then it repairs the DNA with p53 protein production. It increases apoptosis production. It forms autophagy or self-eating initiation. It forms ferroptosis from iron-dependent cell death, and it acts as sense mechanisms, which means it's anti-tumor cells. So the cause of these are cancer linked to the alteration of p53 protein. It also links to the lymphatic system connects with breast tissues and blood vessels. And when there's abnormal function of lymphatic system, it can contribute into tumor cells. And it develops usually when inflammatory cell ingests basal cells and causes tumor cells to grow. Those growths involve inflammation and uncontrollable metastasize and linked to unprotected sexual transmission, or the person wear dirty clothes or bras for many days, and unhygienic breastfeeding. And the patient also experience having diagnosed with breast cancer due to the excessive radiant exposure after diagnosis. So they are diagnosed to breast cancer, the cancer is revealed, and then excessively exposed to radiation. So it's increasing the risk of breast cancer and metastasize, and it comorbid with diet factor and infection as well. So let's get to know what are the risk factors of breast cancer. So modifiable risk factor can be changed, include reducing alcohol and smoking. Higher body mass index is a modifiable risk factor because it increases the risk of cancer with higher fatty tissues and estrogen hormone level. Obesity, people with postmenstrual cycle, high risk of breast cancer. Prolonged physical inactivity with unhealthy diet and contains or consume bad cholesterol, contributing into breast cancer risk. Avoid hormone replacement therapy, which in HRT, it combines estrogen and progesterone or progesterone hormone injection. Those therapy will increase the risk of breast cancer because estrogen and progesterone combined will thick the epithelium layer of the breast, causing higher risk of breast cancer. And administrations of medications with estrogen must depend on dosage requirements and to prevent hyperestrogen. And talk to your doctor when receiving medication involved with estrogens or progesterone doses as active ingredients. The use of contraceptive pill, birth control pill. Birth control pill causes breast cancer because of its adverse reaction side effect, and its prolonged uses or overdose elevate estrogen hormone as well. Reduced breastfeeding without hygiene is another risk factor. However, iodine supplements replacement therapy. It can lower hyperthyroidism, so lower the thyroid hormone, and causing weight loss and improve safe breastfeeding for new mother. And another risk factor is late first-time pregnancy. After age of 30 years old, it will increase risk of cancer because pregnancy hormones can protect against cancerous cells. So late first time having first baby after the age of 30 years old, they have high risk of cancer. Unmodifiable risk factor cannot be changed, and it relates to age factor. It's diagnosis of breast cancer. It influences genetic mutation. Specific gene mutation are the BRCA1 and BRCA2. These two genes develop breast cancer and ovarian cancer easily. Having family with history of cancer and close contact commonly transmits and inherited genes. Gender, females are more likely to diagnose with breast cancer than men. Females will likely to have risk of cancer due to giving birth and breastfeeding in addition with their irregular menstrual cycle patterns. Breast density, if the breast contains more glandular and fibrous tissues, the chances of breast cancer develops is high. Race or ethnicities, Ashkenazi Jewish women are more genetically born with high risk of developing cancer. Irregular menstrual cycle, like early menarche or late menopause, prolong the estrogen hormone, and it will increase the risk of having cancer. And these are unmodifiable. So ensure that menstrual cycle is the regular pattern of menstrual cycle with sufficient nutrition. Personal history of developing a typical hyperplasia, previous radiation therapy, like exposures from the radiation therapy at a younger age, like underwent X-ray or CT scan too many times at a younger age. So excessive radiation exposure can develop risk of cancer too. And there is another risk factor, which is idiopathic breast carcinogen effects. It's a personal risk factor. It happens because of ourselves, not influenced by others or the environment exposure. It includes reproductive risk, like newly parity or early menarche, exogenous hormone uses where injections or transdermal, histologic risk factor like atypical hyperplasia due to proliferative changes like flat epithelial atypia. So those are the skins involved develops the tumor. And then age-related factor is more common for elders with more than 50 years old. So again, age will develop into genetic mutation when we grow older. So more than 50 years old are more likely to get risk of breast cancer. Again, excessive radiation exposure, or the person had Klinefelter syndrome because they're born with extra X chromosomes and it causes reproductive issues, or they had testicular disorder or high estrogen levels since birth, or their family history of having cancer. Let's move on to pathophysiology of breast cancer. So breast cancer develops into 5 key steps. Step 1, genetic alteration. Step 2, uncontrollable cell growth. Step 3, proliferation. Step 4, invasion. And the last step is metastasis. Step 1, genetic alteration. Normal breast cells and DNA damage due to excessive radiations, carcinogen effects, and inherited mutations. After the DNA got damaged from the risk factor, genetic mutation in chromosome causes cell growth that suppress tumor cells. Epigenetic changes in gene expression alter the DNA of breast epithelial ductal cells, leading to progressive damage of the oncogenes, or we know as cancer gene, and it results in advanced metastatic cancer. This causes tumor progression to develop malignant neoplasms. So in step 1, the DNA changes the cell in the body due to radiation, fibrosis, alcohol, medications, or smoking, and then it changed the chromosome, and then it changed the gene, and then it lowered the gene level, and then it leads to lower oncogene, and then it developed cancerous cells. And then in step 2, uncontrollable cell growth, it links to apoptosis. Apoptosis is a cell death program. The suppression of apoptosis accumulates the genes, causing cellular stress, affect genomic aberration, mutation, deletion, and translocation into cellular genome. And then it induces genomic instability, results in the uncontrollable tumor cells, divisions, and proliferation. So when apoptosis activate the DNA damage, steps 3, proliferation. So each cancerous cell suppresses the immune system against the natural killer cells or NK cells. Again, NK cells, it functions to kill cancerous cells. However, cancerous cell, when it suppresses immune system, it ingests natural killer cells and cytotoxic T cell and macrophages. And then the tumor cell grow to proliferate and form new tumor cells. Then this multiplication of abnormal cells in the breast tissues proliferate in step 3. Then step 4 is invasions. So each cancer cell invades breast tissue and spreads to other sites where epithelial mesenchymal transitions. That transitions allow cancer cells to secrete enzymes to break down the extracellular matrix. And the cellular matrix is a network that holds cells together, and the collapse of extracellular matrix facilitates the invasions of the cancer cells. Cancer cells form new blood vessels to nourish or suck oxygen to feed the tumor cells' growth. The last step is metastasis breakdown, when cancer cells spread into other organs through the bloodstream and the lymphatic systems. Tumor cells then form a pre-metastatic niches and repair metastasis of tumor cells grow and their invasion. So these are the pathogenesis of breast cancer. So what are the diagnoses? Diagnosis of breast cancer can be done through clinical assessment with physical examination. So when examining abnormalities of lumps, skin changes, nipple alteration appearances or changing, with breast palpitation technique, the patient can discuss with nurses and doctors to conduct physical examination. Again, breast palpitation, when the tumor cell is motile, it can move. This means the cell is benign and stable condition. But when the tumor cell is immotile, it cannot move. These will spread to surrounding tissues, including axillary lymph nodes, lung, etc. Self-examinations during shower using hand rub in circular motion is more effective to inspect breast lumps. The next diagnosis can check with family history and medical history to ensure there's no family members or relatives close contact diagnosed with cancer. The next one is pathology, where breast biopsy is done with tissue sample collection for microscopic examination to observe suspicious cells. Then there's this health screening on mammogram is the standard X-ray to screen breast. Ultrasound is a solid and cystic masses observation, and magnetic resonance imaging or MRI, it image screening test to spot the cyst using heat waves, but it's costly. Radiology screening is only recommended with initial screening if it can cause radiation exposure if the person already diagnosed with breast cancer. So that means excessive X-ray is unnecessary. Fine needle aspiration or FNA and core needle therapy is also another diagnosis method. It's using needle to withdraw fluids from the lump, but it's only done after diagnosed with breast cancer. If the breast cancer is diagnosed and the cancer result is revealed positive, then diagnosis will still continue with lymph node biopsy. This lymph node biopsy is the sentinel nodes the first node when the cancerous cell is likely to spread to. And then CT breast scan, MRI scan, and bone scan will detect organ, lymph node, and bones to observe cancer spread, respectively. PET scan, or we know as the positron emission tomography, is radioactive to detect cancer, higher risk of cancer metastasis due to radiation exposure from PET scan. Hormone receptor test is to check estrogen or progesterone hormone level, and the HER2 or NEU test. HER2 here is the HER2. I forgot the full words. This is an acronym, but it has a full words of HER2, and it's a protein test to diagnose to find out if P53 protein is sufficient or insufficient. So what are the treatments for breast cancer? Treatments option for breast cancer then depends on types of cancer, stages of cancer, patient's health condition, cost consideration, duration of hospital stays, chances of remission, and patient's preferences. The treatments for breast cancer involve medications, or we know of pharmacological intervention, therapy, and surgery. Medication. In this video, it's based on my research and studying from the university. So some medication generic names should not inform in the video. And I can let you know the specific medication name if you DM me or send message to me and asking why you want to know that medication for breast cancer and what are your questions. Okay, so medications for breast cancer linked to hormone blocker, it to prevent tumor cell proliferation. Aromatase inhibitors can block the enzyme aromatase and convert androgen into estrogen hormone to starve cancerous cells. Cyclin-dependent kinase inhibitor, the 4 and 6. So the CDK4 and 6 inhibitors will inhibit tumor cell growth for early breast cancer. Tyrosine kinase inhibitor, or known as TKI, also known as the HER2 targeted inhibitor, the HER2 targeted inhibitor. It will target HER2 receptor. So that's why we need to know the HER2 protein test for diagnosis. Again, HER2 receptor are human genes that promote cell growth in breast tissues. HER2 receptor negative breast cancer is less dangerous, but when HER2 receptor positive, in breast cancer, it's more dangerous. Herceptin medication. Again, HER2 receptor here, the word HER here is Herceptin. It must have a generic name envizumab, and it target HER2 positive proteins. And then we also have the PARP inhibitor, so PARP. PARP inhibitor, it's a medication used for cancer patient with BRCA1 and BRCA2 gene mutation to block the HER2 negative receptor. With these, chemotherapy can string, inhibit, or block the tumor cells, but it may cause hair loss, menopause, and infertility effect. The therapy, there is hormone therapy, targeted therapy, radiation therapy, and bone strengthening therapy. Hormone therapy is where hormone injection to lower the estrogen hormone level to treat breast cancer with the potential of osteoporosis after the treatment. Targeted therapy is done by medication, such as cyclin-dependent kinase inhibitor, the CDK4 and 6 inhibitor to inhibit tumor cell growth for early breast cancer. Radiation therapy, where X-ray and radioactive laser energy to kill cancer cell, but it has higher risk of cancer metastasis due to radiation exposure. Bone strengthening therapy, usually when the cancer spread to the bone, patient will develop into osteoporosis, the bones disease, chronic disease, and bone strengthening therapy will strengthen the bone and prevent fracture from cancers that comorbid potential. The surgical treatment includes breast conserving surgery, mastectomy, lymph node surgery. Breast conserving surgery is a surgical procedure to remove the cancerous part of the small tumor with a margin surrounding the tissue. While mastectomy remove the entire breast and reconstruct a new breast shape. Lymph node surgery remove the axillary lymph node under the arm. In postoperative and remission period, patients may wear prosthesis bra, and it's designed to support breast structure after surgery. Breast cancer treatment may result in lymphedema. Lymphedema is excessive lymph fluid buildup that may cause swelling, pain, fluid movement restricted, or breast skin changes. So all of those clinical manifestations of breast cancer linked to lymphedema. Lymphatic system. Breast cancer treatment result in lymphedema because excessive fluid buildup when removing lymph nodes from the lymph node dissection surgery. Excessive fluid buildup when radiation therapy damages the lymph vessels and lymph nodes, causing scars and blockage of the buildup fluid inside the vessels. Or when patient undergone prolonged duration of surgery, or they have obesity, infection, and genetic factor that develop lymphedema. So, preventative cares. Um, People can prevent breast cancer by regularly wash bras and underwear clothes with soapy warm water and dry clean without contamination. They need to adjust their diet without high-fat red meats or lower high-fat red meat with low cholesterol to prevent obesity. Avoid wearing tight bra, distressing breast tissue, specifically at nighttime. Regularly physical exercise and pelvic floor yoga can improve the breathing and the overall health. Regular health screening and talk to your doctor or GP if experiencing symptoms related to breast cancer. Tracking your menstrual cycle using menstrual cycle mobile apps, nutrition apps, sleeping pattern apps, and reminder apps to prepare for your healthy hygiene. Also, you can also prevent lymphedema for non-patient for patient without breast cancer. You can also prevent lymphedema as well by compression on bandage and garment to prevent swelling and improve lymph flow, physical massage to improve lymph flow, regular exercise for healthier lymph circulation, skin care to prevent infection, weight management, losing weight to reduce the pressures on the lymph, and hygiene and hydration are highly recommended to prevent lymphedema, avoid breast cancer. And yeah, finally, references available upon request. And thank you so much for watching. If you liked my video, please give a like and subscribe to my channel for more. See you in the next. Thank you. Bye.